Hi everybody, thank you for watching my video. I'm going to be discussing global health issues within nursing. So global health issues really transcend national borders and require international cooperation to help plan, prepare, prevent, and provide solutions for global health issues that affect us all. While a response to global health issues involves government, nonprofit foundations, and private companies, we as nurses play a special role in raising awareness and advocating for all patients. I will be discussing infectious diseases, human trafficking, and maternal newborn health. So my first point is infectious diseases. So infectious diseases can spread quickly beyond national borders, and it doesn't wait for visas or immigration checks at the airport. The spread of Ebola a couple of years ago really highlighted a lack of public awareness regarding the spread of infectious diseases and a lack of a system to deal with such an epidemic. So nurses are advocating for better international communication regarding disease outbreak, and nurses play a special role in implementing a system to respond and prevent disease outbreaks. So we can do this by providing patient care, education for ourselves and for our patients. We need to educate them on the best way that they can keep themselves out of harm's way by preventing spread of disease, such as washing hands, making sure that we're cooking our food properly, and also education for nurses, understanding how we can educate our patients and what to do in case that there is another outbreak. And also, we need to get involved in the legislation. We need to push for implementation of new policies that are going to help protect the public. So my next point here is human trafficking. So this has also been referred to as modern day slavery, and it's a huge emerging global health issue. So we as nurses really need to understand the signs of human trafficking victims to help identify them, and also understand how to do a focused and detailed assessment for possible victims, and also how to properly document this, because these documents can be used in court if they're going against their abusers or if they need to figure out their immigration status. So nurses really need to be aware of the resources to offer victims and how to communicate with possible victims, because a lot of times they might be in denial that they're victims, or they might be scared of their abuser. A lot of times their abusers are always there present with them, so they don't really have a time alone. So we really need to figure out the best way to communicate with them and ask them the right questions. Very recently, in my clinical experience, we came across a potential victim. She had a lot of suspicious signs, and we were able to alert the nurse because we had recently gone through a module regarding human trafficking. So we were really aware of all the signs and how to do this assessment. So it was a great experience, and it really opened my eyes to see that this happens everywhere, not just in, bigger cities. It happens right here in Winter Haven. So my last point here is maternal newborn health. Maternal mortality is a very serious international public health issue, especially right here in America, where more women die from pregnancy-related causes than in any other developed nation. We really need to make sure that we're providing safe and quality care for each of our patients. And we can do this by engaging in evidence-based practice and researching continuously to stay up to date with the best way to provide care for the mothers and newborns. We really need to understand the changes that are occurring in each individual patient and understand if this is normal for them or if this is out of the normal, so that we can quickly respond and provide the necessary interventions to prevent a serious illness or to prevent death. Nurses working in this particular field should really strive to become certified. This will ensure that the nurses have mastered the skills required in this particular area, and it will also help to reassure the patients and make them feel safe and secure, and make them feel like their nurses are really the most knowledgeable ones there for them. In preparing for this video, I learned that the same issues that the world faces, we face right here in America, like the spread of infectious diseases. It is becoming a very serious issue for us here because a lot of children aren't being vaccinated. People don't understand how to stop the spread of infectious diseases, like how to wash their hands, storing their food properly, cooking their food properly, where to get the resources, what signs and symptoms they should be looking out for. So these are all things that we as nurses, myself included, we really need to focus on this. And I'm a nursing student right now, so I still am not working at a hospital, but I'm in the clinic and I see a lot of the patients, they don't understand how to take their medications, or they don't want to take their medications because they're afraid. So really educating them on the side effects of the medications and why it's so important for them to take it. And the same thing with the human trafficking. Like I said, I did encounter a potential victim while I was at my clinical for maternal newborn health. And I was actually really surprised to see that. She did not speak a lot of English, and she had a young appearance. She appeared a little bit malnourished, and also she kept saying that somebody was going to come pick her up, and she was there by herself, which is a little odd for somebody who's about to give birth. So again, taking this class and taking the class that I'm in right now really taught me how to look for those signs and made me realize how important it is as nurses to really understand these victims, because they can show up in any shape or form and we wouldn't know it unless we're being educated properly on how to identify them. And my last point was maternal newborn health. Again, this is currently the class that I'm in for my nursing course, and I've been in the hospital a lot, and I can see how little tiny subtle signs can be missed very easily, and why it's so important for individualized care. If a woman normally has high blood pressure and then all of a sudden her blood pressure is within the normal range, then that would be a little different for her. Or if she normally has really low blood pressure and all of a sudden it's within the normal range for other people, then this is an odd sign. So like I said, we really need to understand the differences between each woman and understand their own signs and symptoms. So again, thank you for watching my video.